An ankle sprain is a very common injury in athletes and non-athletes alike. It happens when the ligaments that hold the ankle joints in place are stretched beyond their normal limits. If there is a severe rolling in or out of the foot, twisting, or turning, the ligaments may actually tear, resulting in an audible pop, pain and swelling, and discoloration. There are 3 grades of sprains. A grade 1 or mild sprain involves slight stretching and some damage to the ligament. Treatment includes rest, ice, compression, and elevation. A grade 2 sprain involves partial tearing of the ligament and abnormal looseness of the ankle joint. Treatment is the same as with a grade 1 sprain, with the addition of a device to immobilize the joint, such as a splint. A grade 3 sprain is a complete tear of the ligament and can be associated with permanent weakness and instability. Surgery is rarely needed, although a short leg cast may be used. All sprains, no matter the severity, will require a rehabilitation program and should emphasize balance training to prevent re-injury. Custom foot orthotic devices have been shown to aid in the recovery from an ankle sprain and improve balance during standing and walking. Follow a program designed by your podiatrist to also include rest, restoring range of motion, and gradually returning to your normal activities. Osteochondral fractures and defects occur when a piece of bone and cartilage within a joint are damaged and in some cases separate from the underlying bone as a result of a trauma. It can often result when an ankle sprain has failed to fully heal or heal properly. Generally, pain is the main symptom, along with a feeling of instability. If pain and instability persist, and if the fracture is not well attached to the bone, arthroscopic surgery to remove loose bone fragments may be needed. If there are no loose bone fragments, non-surgical treatments include immobilization with a cast or walking boot until the fracture heals in place, as well as electrical bone stimulators to help fractures heal. The peroneal tendon runs behind the bony prominence on the outside of the ankle. If the tissue that holds the tendons in place is torn by an ankle sprain, the tendons can slip and result in inflammation. The injury is common in athletes with unstable ankles. Symptoms of this injury include pain when you turn the soles of the feet outwards and upwards, pain or tenderness behind the bone on the outside of the ankle, as well as swelling and bruising. Rest, ice, compression, and elevation are the best treatment options, followed by gentle stretching once the inflammation has dissipated. In more severe cases, a cast may need to be worn and possible surgery needed to mend the tissue that holds the tendon in place.